So my name is Abidi. I'm a child and adolescent psychiatrist at the IWK. I have several roles here at the IWK. One of them is running the youth psychosis clinic, and that's outside of the hospital setting in an outpatient clinic here in Halifax. And in the context of that clinic, I see youth with primary psychotic disorders, youth that are at risk of psychotic disorders, and those with just at the beginning of their first episode of psychosis. The issue that has come up recently is that at the IWK Health Centre we have a 17-bed inpatient psychiatry unit, and on this unit the goal is to see essentially the sickest of youth in the field of mental health and addiction. So those with, for example, psychotic illnesses in the acute stage, or bipolar mania, or severe depression, suicidal youth, those youth that need acute care within the hospital setting from a wide multidisciplinary staff. And this inpatient unit has been around for years, but unfortunately it has been lacking historically, and lacking on a variety of, spokes, I should say. Education for the staff, appropriate staffing, and that includes nursing, other disciplines, psychiatry, program planning, appropriate care. There have been a number of issues. Satisfaction among residents, ability to teach. Over the last year or so, the unit has actually been occupied by over 18, sometimes 19 patients, and essentially over census, and so the care was lacking because of sheer numbers. Prior to coming here, I was in a position where I was actually attempting to keep a lot of our patients off of the unit and see them 3, 4, sometimes 5 times a week, because I was concerned about the care they would receive here. So beginning in July of 2009, I did come. Now, in coming to the unit 4 half days a week, I was forced to give up 1 full day of the psychosis clinic that I run. And I also was forced to give up some of the community work that I do in the municipality, in the HRM. One of the things I was doing previously and hope to get back to after this year is over is a pediatric psych consultation to family medicine clinics. So that falls under the umbrella of shared care. And I actually find that work extremely important because it's a model of early intervention and possibly prevention, seeing youth with various types of mental health problems in their community and in their family doctor's office. So in any case, coming to the unit forced me to at least decrease the amount of time that I spend there. But what I find, and this is the biggest issue, is that I'm stretched way too thin. So the work that I'm trying to do as best possible, I think really what's happening is we're all just doing a mediocre job in each of the different hats or different sites, and that's quite a concern. And I think all of this stems from the fact that we just don't have enough staff, psychiatry staff. So the reason that Dr. French ended up coming to the unit and I ended up giving up what I was doing before to come is because there isn't an inpatient psychiatrist here that can do this kind of intervention and program planning. And whether, there are probably a variety of reasons for that. Number one is recruitment. It's a challenge to do this kind of work, and it's a challenge to try and recruit someone to do it, given that funding is definitely an issue. So essentially what I'm saying is we're just stretched thin here in pediatric psychiatry, and given the fact that we're supposed to be offering excellent care, I'm quite worried that we're falling short of that, despite our good efforts and good attempts.